Hello, Justin Jones. This is Dr. Famuyiwa, and I'm gonna tackle your question about whether pregnancy helps to keep endometriosis in remission. Well, if the endometriosis is superficial, meaning just lying on top of the surface of bowel or peritoneum, you do have sometimes a lot of production of progesterone from the placenta. That progesterone can suppress the symptoms of endometriosis. So that's probably what you're referring to. Now, that can also have issues with it. If the endometriosis is deeply infiltrating or there's an extensive amount, the progesterone causes what we call decidualization, meaning it produces changes similar to what you would get as if you're about to have a menstrual cycle, what happens prior to your shedding. And if that happens and you have a lot of endometriosis in the pelvic cavity, that can cause abdominal bleeding. Now, most of the complications with endometriosis tend to occur in the later half of pregnancy, especially the deeply infiltrating endometriotic lesions. Some of this, like I mentioned, can cause severe bleeding, they can cause early labor or pain during pregnancy. They can also, if it's located in the ovary and it's quite large, which is called an endometrioma or a chocolate cyst, if it gets very large, it can twist, meaning it torses and twists, and that can become a surgical emergency during pregnancy. Also, as the uterus gets bigger as the pregnancy progresses, endometriosis causes a lot of scarring around the pelvic area. So when you have a uterus that's growing with all this scar tissue, it causes traction pain. So patients may experience increased pain as the uterus gets bigger with endometriosis. So I hope that answers your question.